Welcome everyone. Welcome to the Safe Shelter Collaborative's webinar, Building and Sustaining Relationships with Hotels and Motels. I'm Susan Hope Bard, and I'm going to be your host today for this event. We really appreciate you joining us today. We value your time. So we do want to talk to you a little bit about the platform we're using. We're using ReadyTalk, and in the left side of your window you should see a chat box. The chat box is there for you to ask questions during the presenters' sessions. You can feel free to just chat your questions in at any time. You don't need to raise your hand or wait until the speakers are completed. You can just chat the questions in and we will queue them up for Blake and Felissa to answer. The other thing you can chat in is if you're having any technical difficulties. So if you can't hear or you're having problems seeing the screen or with anything rendering on your computer, let us know and we'll try to work with you. All of the lines are muted, so as folks are joining us you may hear a short beep as new participants join, but everyone will be muted so that we can have a clear recording for folks to watch and hear later. If you do lose your internet connection, you can always reconnect using the link that you received in your registration email or in any of the reminder emails. If you lose your phone connection, you simply redial the phone number that's in that same registration confirmation or reminder. As I mentioned, we are recording this event. You will receive an email that will contain a link to the recording, the presentation, the PowerPoint presentation, and any resources that are mentioned today by the presenters or things that the Safe Shelter Collaborative wants to share with you. Generally we get that out in about a week, and you should get that by email. It will also be a ReadyTalk email, so be on the lookout for that. As we get started, I'd like to talk to you a little bit about our amazing presenters who have dedicated time and expertise to putting this presentation together. We have Blake. She is the Executive Director for the Salvation Army, and she holds a master's degree in clinical psychology and is a licensed marriage and family therapist. Through her clinical work, she brings knowledge and experience working with survivors of domestic violence, and she has 10 years of management experience in the social services field. She's worked for the Salvation Army for 8 years, and she's responsible for financial, programmatic, and operational oversight of the Carr P. Collins Center and its many programs which serve in the areas of domestic violence, homeless recovery and homeless prevention, substance abuse, and offender reentry. Also joining us is Felissa Richard, and she is the Program Manager for the Salvation Army's Domestic Violence Program. She has a master's in public administration and 6 years of experience helping survivors with legal advocacy and crisis counseling, as well as experience with broader community engagement and education. She is responsible for managing all of the aspects of the shelter along with non-residential services provided to survivors of domestic violence. As I mentioned, I'm Susan Hope Bard. I am the Training and Education Manager here. And also on the back end, we're very fortunate to have folks that are supporting this webinar that will be chatting out with you. They'll be chatting you out information, links, and also providing you with the technical support. We have Leah from Caravan Studios, Sarah from Caravan Studios, and Tiffany from Caravan Studios. And Caravan Studios is the umbrella organization for the Safe Shelter Collaborative. And that's a great segue for me to talk a little bit about the Safe Shelter Collaborative. The mission of the Safe Shelter Collaborative is designed to improve access to urgently needed shelter for a greater number and diversity of survivors of human trafficking and domestic violence. How do they do it? Well, the Safe Shelter Collaborative increases the capacity of organizations to offer survivor-centered, trauma-informed care to human trafficking and domestic violence survivors. They also provide technology to maximize the ability to find available and appropriate shelter space. And what we'll be talking about today is some of that technology. So they also offer a means to source funding for a hotel room when that is an appropriate and safe option for the survivor. The Safe Shelter Collaborative was built by Caravan Studios and Polaris. The collaborative is a growing community-based network of nonprofits, funders, government agencies, and individual donors that is designed to provide faster access to more shelter for more and a greater diversity and number of survivors of human trafficking. And these are some of our funders. So I'm going to turn over this presentation to Blake, and she will begin to talk a little bit about the Salvation Army's, how they built and sustained relationships with hotels and motels. So Blake, the floor is yours. Thank you.
Thank you so much. And we are really excited to be able to share some of the lessons learned as we've navigated this process of bringing on new hotel partners. After that great introduction, I don't have much to add other than I'm Blake Fetterman, and I'm the Executive Director for the Salvation Army Carpi Collins Center.
And I'm Felisa Richard, the Program Manager for the Mystic Valley Shelter.
And we signed on with, we finally got a hotel partner back in December 2015, so we're about a year and a half into this, well, I guess a year and a month. Now, Felisa was not with the Salvation Army when we went through this process of partnering with a hotel. So you will hear a lot more from me in the beginning as Felisa will add in stories about our experiences since we have signed on with a hotel. She's also a great person to ask questions about how we handle various situations since partnering with a hotel. So our goal today is to take you from cradle to grave on how to develop and maintain a relationship with a hotel. I'll be frank, we stumbled our way through various parts of this in the beginning, and we really just want you to learn from our mistakes while also sharing some key points that helped make this process a lot easier for us. So we'll go through the minimum criteria that you need to look for, helpful tips, lessons learned, developing the partnership, and maintaining the relationship. So, where to begin? So we want to walk you through some of the key areas we found helpful when starting the hotel search. I'll be honest and share that there is a lot of upfront work that you're going to need to do in order for this to be successful, but I guarantee you it'll save you time and headaches down the road. We do not recommend just blindly calling hotels without first doing some due diligence. And so we're going to walk you through 3 key areas that helped us determine our minimum criteria for hotels. So the first one is regarding funding. So you need to read your contracts and review the standards you are required to meet as a condition of your funding. For us, it was the Texas Administrative Code. So we receive funding from the Texas Health and Human Services Commission, and they require that we follow a full set of standards. So the 2 that we paid closest attention to had to do with whether or not we could even use motels. And what we found is that we can, as long as we're using them in an emergency capacity and not as an actual shelter. And you might think, well, I'm not actually using the funding to pay for the hotel because I'm going to use this wonderful Safe Night app and use crowdsourced funding to pay for the hotel. But you will likely be using contract-funded staff to provide the support services. So again, check to make sure this is an allowable cost. The other thing we really wanted to look for is what does the Texas Administrative Code say about provisions of food and other basic needs? This will help you determine what kind of hotel you need. Does it have to have a kitchenette? Or will you provide meals through food vouchers? Or will you deliver meals? we operate a food pantry here at our center, so we have really easy access to food for clients staying in a hotel. So we thought it would be best to look out for a hotel that had a kitchenette. But we also provide box meals from our kitchen as needed, which Felisa will talk to you a bit about.
In the program now. And what we do with food, we have him to call us in the morning time by 9:30, and that would ensure to let us know if we need to order lunch for him, order dinner for him. And usually he'll call in by 9:30, say yes, and we make sure we have that for him. Now, I know Blake is talking about food. Another issue that came about was laundry with us, so you might want to think about how the client will take care of their laundry. For us, we use petty cash. The hotel has a laundry facility, so we use petty cash that we give to the client to help them do their laundry.
So the next thing that we looked at and that was important to us is thinking about the proximity of the hotel to our shelter or service center. So when you're thinking about how am I going to provide for their meals, how are we going to provide for their advocacy and counseling center, this is when that proximity is really important. The questions you need to ask are things like, are you going to be asking the client to come to your center for services, or will staff be traveling to the hotel, or a combination of both? We also asked ourselves, think about if there is a crisis, how long will it take for the client to get to you, or vice versa? Do you have a good public transportation system? When you're kind of working through all of these questions, Google Maps is a great resource for this. Once you put in your address into the Google Maps, if you click on hotels near me, they will pop up on the map, and then you can start figuring out your radius to help narrow down your hotel list. Another consideration with your radius is hotel cost. If you happen to be in an area where all of a sudden what's popping up are like Ritz-Carltons and Fairmont hotels, then you're probably going to need to expand your radius for the simple reason that you will not be able to find donors to fund hotel rooms at that price point.
Yes. Staff will be traveling to the hotel as well as clients will be coming to us. So we settled on that 3-mile radius. We also was taking in consideration if we had a crisis. We're like 5 minutes away by car if we needed to get to the client if they had a crisis. Fortunately, we haven't had that to happen. So I think it's good to take that in consideration if you need to get to the client because their location has been identified or if they are having a meltdown or a crisis, you want to make sure that you can get to them easily. Also, in talking about clients coming to us, take in consideration if, clients don't always have transportation, so we might want to think about how will they get to us. If your agency don't provide that transportation, you can do bus passes. We have bus passes that we give to our clients to come to us or go to work or take their children to school. Also, if you don't have funds for the bus passes, you can definitely reach out to your donors to get that assistance.
So next, and as you heard from Felisa, the public transportation was a big issue for us, and many of our clients rely on public transportation. So in addition to having a hotel that is in close proximity to our center, we also wanted to make sure that it was right off a bus line. This was also a contributing factor to how far we were willing to have the hotel from the service center. So Dallas does not have the best public transportation. So while the hotel might only be 3 miles away, when we did the route, again using Google Maps, using the public transportation option, we found that it was 15 to 20 minutes on public transportation. So we also recommend, though, don't just rely on Google Maps to help you see, oh, look, there's a bus stop. You know, it looks like it's right next to the hotel. You know, that distance can be really deceiving. So we got in our car and we drove around to look at where the bus stops were in comparison to the hotel. We were looking not only for distance, but safety. So, at this point, you have narrowed down your list of potential hotels based on the type of hotel that you need, the proximity it is to your shelter or service center, and public transportation. So now what? We thought we would start by dazzling you with all the brilliant things that we thought that we did as we went through this process before shamefully going through all of our mistakes. So let's start with the good. This was honestly by far the most helpful thing we did when trying to identify a hotel partner, and it was linking with the Dallas Police Department. So we went to our local division and sent them these hotels, those 7 that we had identified, and asked them to help us identify hotels that were safe. We wanted to make sure both in and around the hotel that there wasn't a lot of illegal activity, violence, drugs, etc. And in addition to eliminating hotel options for us, as you can see, they identified drug dealing and other issues in the surrounding hotels. They also sent us a hotel recommendation, which was really great. At the end of the day, we were able to take a list of 7 and bring it down to 3, and that saved us so much time I can't even tell you. Now, if you can't identify a hotel within your radius that the police identify as a safe option, we would absolutely suggest you consider expanding your radius. And if you don't have a relationship with your local police department, just call the local division or go by and ask to speak with the patrol sergeant, and they should be able to help you. So we had our list of 3 hotels, but we wanted to do a little bit more due diligence before we started approaching them. And so we wanted to really concisely know exactly what it was that we were looking for from the hotel. And as you're making that list, I guarantee you it'll start to get exhaustive. So we recommend that you really think about the big picture items when you're starting to make that ask. So for us, those big picture items were an affordable negotiated rate, make sure we could maintain the confidentiality of our clients, and then establishing mutually agreed upon payment terms. The confidentiality issue for us was huge, and it was a deal breaker. We would not recommend partnering with a hotel that does not allow you to book a room using an alias, or if they require the person to put a credit card down for incidentals, because that is a huge safety risk for the person seeking safe shelter. The next thing you have to think about is know your own capacities. What can your organization bring to the table? What assurances can you provide? For example, we knew as a Salvation Army we could not meet net 10 payment terms. The Salvation Army is a huge organization. We have several layers of checks and balances before a check request can be processed. And so we knew going in that we had to ask for net 30 payment terms. It's important to manage expectations up front in order to maintain a happy partnership.
Yes, so with the confidentiality piece and being able to get the client in, I always use my name, Felisa. I book the room up under my name so that it won't put the client in any danger. We would take the client, me and another staff member would go and take the client to the hotel and check them in with our information and all that. But one thing we did do, just in case the client locks his key or her key in the room or loses their key, well, you need your name to get it. So we came up with like a 4-digit code that they can give to the front desk person, and they put that code in, and they'll know that this person belongs in that room. So that was one thing that we take pride in doing.
Okay, so now it is the shameful admissions of lessons learned from the mistakes we made. So you might think you're ready to start pounding the pavement, but think about how you want to approach the hotels. We made the mistake of going directly to the local hotel and trying to work with the on-site managers. And we found that they were either not responsive, we would schedule meetings, they wouldn't show up, they wouldn't return phone calls or emails. We found that they would only provide kind of canned answers about what they could or could not do, and ultimately we learned that they were not the decision makers. We were also trying to work with too many hotels at once, and that was hard because hotels have different requirements and expectations, and since this was a new program for us, it was making it hard for us to establish program protocols, which would be hard for the staff as they're trying to navigate this new system. Regarding the negotiated rate, read the fine print. So a few slides back, we talked about defining your radius and ensuring the hotels in your radius were at a good price point. So we didn't really have that issue, but we did have the issue of being near a convention center and hotels wanting to charge a higher rate if there was a convention in town. And that is certainly their right, but we weren't comfortable with it because it created unknowns of when the price would jump and for how long. And since ultimately we decided to only work with one hotel, it was important for us to have a consistent rate. And we'll talk more about the rate on the next slide and other considerations. Okay, so we are ready to start developing that partnership. So as you heard, we quickly, although not so quickly, learned that the corporate office is the way to go. They are the decision makers. So when you are making the call, let them know you are calling from a nonprofit and you are looking to contract with them for hotel stays. That's all you need to say on the upfront. They will get you connected to the right person within their division. And when you get that right person, just remember that most of the time, these hotels don't need your business. And then especially since we're asking for a lower rate than their normal rate, so we really have to sell it with enthusiasm and tug at their heartstrings, okay? So we shared that, look, we are the Salvation Army and we help survivors of domestic violence find safe refuge when they leave their abuser. And that unfortunately in our community, the reality is that the demand for safe shelter is the need can't be met. And so there are survivors who are seeking safety but can't because the shelters are full. But that we excitedly have a solution for that, that we've got the capacity to put survivors in hotels very quickly to get them to safety, but that we need their help to be part of the solution, and that with their help, together we have the opportunity to save someone's life. So we were really lucky, and the first person we spoke to at Extended Stay America was an amazing champion of this project. She worked with us the whole way through, what was neat, I think, is that she wasn't a manager. She was just the staff person that answered the phone. And she became our primary point of contact because she was the one that really believed in our project. And so I was her sole point of contact. She was my sole point of contact. I helped get through the negotiations and the contract signing, and then Felisa became the one point of contact. And that was really important because there was a lot of going back and forth in the beginning, so I wanted to make sure, okay, Kim, I need your name, I need your extension, I need your title, I want your email address, so that she takes ownership of this project alongside us. Making sure that she had the same thing in return was really important. I mean, you guys know there is nothing more frustrating than calling a general number, getting transferred 2 or 3 times before you can speak with someone who can help you. And because Kim was so enthusiastic about this project, she actually worked with her boss to get us an even lower rate than their typical nonprofit rate. So you don't always have to accept the first rate offered. I would also encourage you to find out if hotels have variable rates based on length of stay. So some hotels will offer a lower rate the longer you stay. Our rate, for example, goes down by more than 25% when we book a room for more than 7 days. So once the terms have been decided verbally, get it in writing. Most hotels will already have a standard contract for these types of corporate partnerships, but read it thoroughly and make sure it captures everything that you discussed.
So now it's time to maintain that relationship and work with the staff at the local level. Actually, Kim had set up the meeting time for me to go out and a couple of the other staff, coworkers, to go out and meet with the manager and their frontline person to educate them on domestic violence just to start with and how we're doing what we're doing. And so we took a tour of the facilities and to see what amenities they had. They had laundry, they had a workout room, they even had a conference room. So when we go over to meet with the client, we can meet with them in the conference room. Having that contact person with Kim at the corporate level is good because when it's time for us to book a room, I just contact Kim and she takes care of everything, send me the confirmation and all of that good stuff. So we don't have to go back and forth in that regard with the local manager. She takes care of everything. One thing we do, we take the client over. Once the client comes in, do the hotline on the phone, they come into our non-residential center. We make sure they have what they need when we get ready to take them over to the hotel. We make sure they need hygiene, they need food, any clothing or what have you. We make sure that they have those things. Again, we provide them with bus passes so they can come back and meet with their advocate and everything. One thing that is important is to keep in touch with the hotel, even if you don't have a client, because management changes. And I don't get this heads up from corporate or anything. I just found out one day that it was a new manager. So we realized then that we have to keep in touch with them and talk to them and just pop up and show up and just to say hi, just in case management does change. We was billed the wrong rate one time, and so we had to call Kim and explain that to her, and she called the manager and they straightened it out. So I think it's very important to be responsive and stay in touch with the hotel and with the staff to make sure that they know the expectations of the clients and what we expect from them as well. We give them a list of things that we expect from the clients and the do's and the don'ts when it comes to the hotel. They can't order pay-per-view. They can't add other things onto the bill that is strategically is for and strictly for just for housing. So maintaining that relationship with the staff is very, very important.
So that takes you through from what we would say cradle to grave in terms of where do you start and then how do you keep it going. We can open it up at this point to questions.
Great. Thanks, Blake and Felisa. We have got quite a few questions. I think I'm going to start with Cassie had a question. Would you recommend using your agency name as a check-in name for the client versus a staff person's name?
So I would caution against that because if your agency name is associated with, like Salvation Army is a little easier because we do a lot more than just provide services to domestic violence survivors. But if that's all your agency does, that might be a bit of a flag. But there are so many different ways that you can go about this. You can use an alias. You can use someone's initials. This is what we decided, and it worked for us. It was just kind of the easiest thing to remember. But there are several options to go with, and you can actually even work that out with the hotel as well about what is easiest for you. This is our recommendation.
Thank you. And I think the other thing is everybody on the line now that is joining us, we've just heard from the Salvation Army and other agencies that use pseudonyms instead of the staff person's name. They make one up. How have you, agencies on the line, done this? Chat in. Tell us what you've been doing. And as you're doing that, I'm going to ask you another question from Patrick. How do you navigate through the stigma of domestic violence or human trafficking? How do you handle that with the hotel? And I guess, Patrick, I want to make sure I clarify the question. This is in relation to the hotel training or the hotel educating the hotel. If you could just chat that in.
So, luckily we didn't have that issue. Having that person at the corporate office that was so excited about this prospect I think really helped. But what was important when it came down to the local level education was not scaring them, right? So we want to provide them with enough information that they feel comfortable in what we're doing, but not enough to terrify them and make it so that they just don't want to work with us. But we were really fortunate that it was well-received information, and again, everyone felt like they were part of this solution to an issue in our community. So we were really lucky in that regards.
Thank you. We have a couple of other questions. Have you ever had any issues with a relationship that was considered a good one? So something happened, and how did you resolve it?
I'm not sure I understand the question.
Sure. I believe it's if in your relationship with the hotel that you described today, has there ever been any, either minor or major issues that have occurred, and what has the Salvation Army done to resolve the issue?
Sure. So one thing that happened right after I think it was our second client that we put in the hotel, and it was a really long stay. It was almost, over 30 days. It was a male survivor. And they were billing us at the wrong rate. And because the local office in the beginning was sending us our bills, but for some reason they didn't have our negotiated rate on file with corporate. And so we were getting these local bills, and fortunately we caught it, and we were able, because we had that great point of contact at the corporate office, to go right to Kim and say, hey, what happened? And she fixed it within a day. We got the right invoices, and were able to get the hotel promptly paid. So that just goes back to what Felisa was saying in terms of maintaining that constant contact, even when we're not using the hotel, just so that we can keep that relationship alive.
Great. Thank you. Okay, another question is, how do you know that a client is a good fit for a hotel stay?
Okay, so what we usually do with our residential shelter is when we do the hotline assessment, the incident has to be within 30 days. But with our hotel clients, it has to be within 7 days. The imminent danger, it has the incident happen within 7 days, and that's where we start to see if they are a good fit with us, along with the safety perimeters within our. They live within our safety radius, which is 5 miles from where we are. That goes into detail too. But the first thing we want to make sure that the incident happened within 7 days.
The other thing that I would add to that as well is if we identify through the hotline process as we're going through that crisis call that there are significant behavioral health needs, if there's any expression of wanting to harm herself or extreme depression, then we might not utilize the hotel, and that's when we might have to roll out a cot into our children's playroom to bring them into the shelter instead of utilizing our hotel, just because we would want to make sure that the survivor's in a really safe place that's surrounded by people that can kind of keep an eye on her.
Thank you. Another question that came up is you talked a little bit about selling your proposal, and I know you found a champion in this particular hotel chain and with the corporate office. But can you talk a little bit more about recommendations, how other agencies might go about selling their agency in this particular service? Is it effective to use statistics, stories? Is there an orientation package or something that you use to educate the hotel?
Collateral materials are always helpful. So if you've got, for us, the Extended Stay America offices were not in Dallas, and so we were working with someone in another state. But if it's an in-person meeting or even someone who's in another state, sending over collateral materials are always helpful. I always think sharing impact stories is a great way to go. You are personalizing it. You are putting a face with a statistic, and it really helps people understand the impact that they can have. And statistics generally, numbers are numbers. So I would try to make it as personal as possible. Talk about maybe someone who you recently had to turn away because of lack of shelter space, and what that is like, and how what an impact it can have to be able to have a different answer than "I'm so sorry, we're full."
Great, thank you. And in that same vein, but now talking about the local hotel, you spoke about educating those frontline staff. We've heard from some agencies that train hotel and motel staff on domestic violence. Does the Salvation Army ever do that to help people kind of build a mental model of the amazing thing they're doing for your community?
So with the hotel that we're working with, yes. Going to hotels in general to do that type of training, no, that isn't something that we currently do.
So you provide the training for the established relationship?
That's correct. So Felisa and her team, several members of her team, went out and met with, as she described, the hotel manager as well as the front desk staff, those that are going to be taking the calls and meeting us when we go over there to present a client. And they have done training with them on, okay, what is domestic violence? What are we doing? How are we supporting? What they can do if there's an issue.
Great. Thank you. And we do have another question. And everyone else, just make sure you chat in your questions to us so we can queue them up. What sort of guidance do you provide clients on maintaining their own safety while at the hotel?
Yeah, so we do go over safety planning. We talk about safety planning in the public. We talk about also safety planning at your workplace, but when they meet with their advocate, they go into intense safety planning, who to call and what, turn off who to call when they are in a dangerous situation. Where would they go? What would they do? We also instruct them to turn the GPS off on their phone so that they can't be located, or if they have a tablet or anything like that, just turn the GPS off so that they can't be tracked in that way. But we definitely go through safety planning with them, some helpful tips if they see their abuser, or if something happened, what can you do? So we come up with scenarios with, if this happened, you can do this or what have you. But at the hotel, we definitely meet with them to go over safety planning.
Thank you, Felissa. That's actually the important part of the process. And can you perhaps talk a little bit about Safe Night and how you guys use it, kind of in relation to what we've just spoken about in building and develop and maintaining relationships with hotels and motels? There are probably some folks on this call who don't use it yet.
Sure. So we have a great relationship with the other domestic violence shelters here in Dallas. So the first thing we do when we get that call on our hotline and we know that we are at capacity, or if it's a male survivor who is calling, and we don't serve males in our shelter, we look on our coordinated assessment sheet that is something that we've done with our local shelters to see if any other shelter in Dallas has space. And if it looks like all the shelters in Dallas are full, that's when we initiate the Safe Night process. So what that looks like for us is getting the survivor to the hotel. We do that first and foremost, getting that person into safety. And then we are going to put out a need request through Safe Night. And so for those of you who don't currently use Safe Night, it's a wonderful app that allows you to use crowdsource funding to be able to secure funding for hotel rooms when your shelter is full. And there is some additional legwork kind of aside from the hotel stuff that we would encourage you to do. Make sure your donor base is aware, send out regular communications about Safe Night, in addition to putting through the request through the app, sending a follow-up email to your donor base saying, okay, we've got a need out there. We need your help to meet this need. We typically are using Safe Night on an emergency basis only, meaning we will keep them in a hotel until another shelter. It doesn't have to be ours, but until any shelter has an open bed. So every day we are checking the coordinated spreadsheet that we use to see if there's space. And when there is, we work with the survivor to get them to that shelter. One huge unmet need here in Dallas is options for male victims. So we know that when we get a call from a male survivor that we are likely going to be sheltering that person for 30 days or more until we can find them their next safe spot. So that's when the continual emails will need to go out to your donor base, because they're going to start wondering, why am I keep getting pings? I've received 20 in the past 20 days. So just making sure you've got that ongoing communication going will really help make sure that your bed needs get met. Does that kind of answer?
Yes.
Do you want more? Yeah, okay.
Actually, I'm actually going to just tag on a little extra question there, and you may or may not know this right off the top of your head. Can you tell the folks on the line now, like, how frequently you've used the Safe Night feature?
So we've had. It's not it's not about how frequent we use it as much as for how long we're using it. So we because we're using this so it's so new. We won't put more than one. I think at the most we've ever had is 2 at a time, but we really try to keep it to 1 at a time because we also want to manage our own staffing resources. So we might have one, and our first male survivor that we worked with, I think, was 6 weeks. He was in the hotel, and we have one right now, a male survivor, and he's been in there since January 10th, and we expect it'll still be another couple of weeks. So, I think we've either had 4 or 5 in the past year that we've used, but it's been for extended periods of time.
Wow, that's amazing. That's a very long time. Thank you. That's a good, that really illuminates it. Let's see. I don't see any other questions, so I'm going to put it out to everyone one last time. If you do have any additional questions, you can chat it out as we wrap this up. I want to just make sure everyone knows that Blake and Felissa are available. You can reach out to them. Their emails will be in the follow-up email that we send out along with the recording and the PowerPoint presentation. Really, Felissa and Blake, this has been an amazing presentation. You've put it together and it was so organized. Thank you so much. I don't know if there's anything. Oh, we just got a question. Did you train the staff at the hotels that you work with about trafficking before booking rooms there?
So we are not using the hotels for human trafficking survivors. We are using it for survivors of domestic violence. So we did not include human trafficking information as part of our training. But if that is what you are using the hotels for, then I would say absolutely include that in your presentation with the hotel staff.
Great. Thanks. Thanks for getting that one last question in there. And what we'd like to do now is ask all of you on the line on this presentation to chat in one thing you learned today. Something that you're going to share with your colleagues, other agencies within your network. And as you're doing that, I am going to thank Blake and Felissa again. They've spent a lot of time putting this presentation together, and the Safe Shelter Collaborative is very grateful for their time and their expertise. Here at Caravan Studios and the Safe Shelter Collaborative, we want to thank you for your time and attention. We know that it is the most valuable asset you have with these sensitive populations that you serve, so we thank you very much. We also want to thank you for your commitment to this community. We're happy to hear from you, so we do have resources here. You can call or text 415-323-6283. You can always email us at support@safesheltercollaborative.org or visit us online at www.safesheltercollaborative.org or find out more about Safe Night at www.safenightapp.org. So I want to thank you very much for your time today. I want to thank ReadyTalk for their sponsorship of this webinar. A huge shout out to Sarah, Leah, and Tiffany who have been on the back end chatting things out. And you will see a survey that pops up when you close out of this webinar. The Safe Shelter Collaborative really does want to continue developing and delivering content that's relevant to you. So please take perhaps 30 seconds and complete that survey, because that will tell us what you thought of the content and also give us ideas about how many other things we can do to support you and other content we can develop for live events. I want to wish everyone a very happy weekend. And again, thanks Blake and Felissa.
Our pleasure.
Thank you.